Welcome back to Metta Health Talk. Today we are talking about one of the most common illnesses that affects people around the world, the stomach bug. What we call the stomach bug is usually viral gastroenteritis, an infection of the stomach and intestines that causes diarrhea, vomiting, abdominal pain, and sometimes fever. It is incredibly common, especially in winter months, and it affects people of all ages. Every year, it causes millions of doctor visits and thousands of hospital admissions. The important thing to understand is that the stomach bug is not the same as influenza. Influenza is a respiratory virus that causes fever, body aches, and cough. The stomach bug attacks the gastrointestinal tract and causes inflammation of the stomach and intestines, which is why gastroenteritis is the proper medical name. In this masterclass, we will explain the causes of the stomach bug, the symptoms you should expect, how doctors diagnose it, and the most effective treatments. We will also discuss when it becomes dangerous, especially for children and older adults, and how to prevent dehydration, which is the biggest risk. The stomach bug is inflammation of the gastrointestinal tract caused by infection. The medical term is acute gastroenteritis. It can affect the stomach, small intestine, large intestine, or all three. Most cases are caused by viruses, which is why doctors call it viral gastroenteritis. Bacteria, parasites, and sometimes chemicals can also cause similar symptoms, but viruses are by far the most common cause in healthy adults and children. The inflammation causes the intestines to secrete extra fluid, which leads to watery diarrhea. It also irritates the stomach lining, causing nausea and vomiting. The combination of fluid loss from both ends can quickly lead to dehydration if it is not managed properly. Stomach bugs are highly contagious because the viruses are shed in stool and vomit in large amounts. Just a tiny amount of contaminated material can infect someone else. That is why outbreaks often happen in schools, cruise ships, nursing homes, and families. Viruses cause about 70% of stomach bugs in adults and even more in children. The most common virus is norovirus, which causes about 50% of cases worldwide. Norovirus is very hardy. It can survive on surfaces for days and is resistant to many disinfectants. Rotavirus is the leading cause in young children. Before the rotavirus vaccine, it caused hundreds of thousands of deaths each year, mostly in developing countries. Now, vaccination has reduced severe cases dramatically. Other viruses include adenovirus, astrovirus, and sapovirus. These viruses spread through fecal-oral transmission, meaning contaminated food, water, hands, surfaces, or close contact with an infected person. Bacterial causes are less common but more serious. Salmonella, Campylobacter, Shigella, E. coli, and Clostridium difficile can cause bacterial gastroenteritis. These often come from contaminated food or water. Parasites like Giardia and Cryptosporidium are also possible, especially in travelers or people drinking untreated water. Chemical causes include food poisoning from toxins or overuse of medications like NSAIDs. The symptoms usually start suddenly, 12 to 48 hours after exposure. The most common symptoms are watery diarrhea, nausea, vomiting, stomach cramps, and abdominal pain. Diarrhea is almost always present and is usually non-bloody and watery. Vomiting is more common in the first 24 hours, especially in children. Stomach cramps can be severe because the intestines are inflamed and trying to expel the virus. Other symptoms may include low-grade fever, chills, muscle aches, headache, loss of appetite, and fatigue. Dehydration symptoms like dry mouth, decreased urine output, dizziness, and sunken eyes can develop quickly if fluid loss is not replaced. Symptoms usually last 1 to 3 days for norovirus and up to 8 days for other viruses. Children and older adults may have more severe symptoms and take longer to recover. Most healthy adults recover from the stomach bug without problems, but it can be serious for infants, older adults, and people with weakened immune systems. Dehydration is the main danger. When someone loses a lot of fluid through diarrhea and vomiting, the body cannot function normally. Severe dehydration can cause electrolyte imbalances, kidney problems, shock, and even death, especially in small children. Signs of dangerous dehydration include no urine for 8 hours or more, very dry mouth and lips, no tears when crying, sunken eyes or fontanelle in babies, rapid heartbeat, confusion, or lethargy. These require immediate medical attention. People with chronic illnesses like diabetes, kidney disease, or inflammatory bowel disease may also have more trouble. Pregnant women and people on immunosuppressive drugs should be extra careful. Doctors usually diagnose the stomach bug based on symptoms and history. They ask about recent travel, food eaten, contact with sick people, and whether others in the household are ill. Stool tests are not usually needed for healthy patients because the illness is self-limited. But if symptoms last more than a week, if there is blood in the stool, high fever, or severe dehydration, doctors may test for bacteria, parasites, or C. Blood tests may check for dehydration or electrolyte problems. In children or high-risk patients, doctors may do more testing to rule out other causes. There is no specific antiviral treatment for most stomach bugs. The virus must run its course. The main goal is to prevent and treat dehydration. Oral rehydration solution is the best treatment. It contains the right balance of sugar, salt, and water to help the intestines absorb fluid. Sports drinks or diluted juice can help adults, but ORS is best for children. Intravenous fluids may be needed for severe dehydration or if the patient cannot keep oral fluids down. Hospital admission is sometimes necessary for monitoring. Anti-diarrheal medications like loperamide can help adults with watery diarrhea but should be avoided if there is fever or bloody stool. Antiemetics like ondansetron can reduce vomiting in children and adults. Probiotics may shorten symptoms slightly, but evidence is mixed. Antibiotics are only used for bacterial causes, not viruses. At home, the focus is rest and hydration. Start with small sips of clear fluids every 15 minutes. Avoid sugary drinks, caffeine, and alcohol, which can worsen diarrhea. The brat diet, bananas, rice, applesauce, toast, is gentle on the stomach once vomiting stops. Gradually add plain foods like crackers, boiled potatoes, and yogurt. Avoid dairy, fatty foods, spicy food, and caffeine until fully recovered. Heat packs can soothe cramps. Acetaminophen can help fever or headache, but avoid NSAIDs like ibuprofen because they irritate the stomach. The best prevention is good hygiene. Wash hands with soap for 20 seconds, especially after toilet use and before eating. Disinfect surfaces because norovirus is very hardy. Rotavirus vaccine protects children. Avoid sharing food, drinks, or utensils with sick people. Cook food thoroughly and drink safe water when traveling. See a doctor if symptoms last more than 48 hours in adults or if there is severe dehydration, bloody stool, high fever, or confusion. Children under 6 months or adults over 65 need care sooner. The stomach bug is usually a short, uncomfortable illness caused by viruses like norovirus and rotavirus. Symptoms include diarrhea, vomiting, cramps, and dehydration risk. Treatment is hydration, rest, and symptom relief. Prevention is hygiene. Thank you for watching Metta Health Talk and stay tuned for more evidence-based medical education.